recording mandibular teeth position, VDO, and centric relation. If the patient can open wide enough to allow both maxillary impression and mandibular tray to be inserted together, secure the maxillary eastant impression to the mandibular eastant tray using elastomers. Mix putty PVS impression material with a catalyst to base ratio of 1 to 12 and apply it to the tissue side of the mandibular eastant tray. Put less moldable material, leaving the buccal and lingual support area not covered, especially the lingual area. It is a little difficult to do the border molding at this stage. You want to focus on the teeth position and occlusal relationship, not want to have overextension of the border. Seat the maxillary eastant impression together with the mandibular tray completely in the mouth. A good maxillary impression should have slight suction and remain stable in the mouth without support. If the maxillary impression is unstable due to severe ridge resorption, apply a small amount of denture adhesive to the tissue surface of the maxillary eastant impression before seating it. This will stabilize the impression in the mouth and eliminate the need to hold it in place by hand. If the patient cannot open wide enough to fit both trays in simultaneously, leave the elastomers on the hooks of maxillary eastant impression and seat the maxillary impression in the mouth. Then add the moldable material to the tissue side of the mandibular tray and insert the tray into the mouth. Hook the 4 elastomers from the maxillary eastant impression onto the hooks of the mandibular eastant tray. This will free your hands to record centric relation and VDO. Guide the patient to bite at the centric relation slowly into the preset starting VDO using a tongue blade or eastant measure as a guide. If the hooks on the maxillary eastant impression were trimmed away when you were adjusting the maxillary eastant impression, or it is too difficult for you to put the elastomers from the maxillary hooks to the mandibular hooks, you can also just use one hand to hold the mandibular tray and guide the patient to bite into centric relation using the other hand, and then grab the tongue blade or eastant measure. Let the patient continue biting until the distance between the lower border of the septum of the nose and the lower border of the chin is equal to the preset starting VDO. Once the jaw is at the correct position, make sure the patient stays in this jaw relationship. If you put extra material, use your finger to pull the lips to mold the extra material out and remove the extra material. Remove the 4 elastomers and separate the maxillary impression with the mandibular tray quickly. Hold the mandibular tray in position. Let the patient move the tongue around to mold the lingual border. By the time the elastomer is removed, the putty PVS material might be partially set. It might be difficult to mold the border very well, and it might be easier to get an overextension. That's why you should not put too much moldable material in the lingual. Putty impression material will self-set completely in about 5 minutes. Now you have a customized mandibular eastant tray that records teeth position and jaw relationship.